Our risk assessment to the general population is still low.
After the first reported human death from H5N1 bird flu in the United States, the World Health Organization on Tuesday said that despite the recent death, the risk to humans remains low. The patient who died from the virus in Louisiana was over 65 years old and had been exposed to both backyard chickens and wild birds. That's according to health officials who said the patient also had underlying medical conditions, heightening the risk for serious disease.
In a way, the risk is pretty localized, although it does seem to be growing across the U.S.
Sarah Michaels is an assistant professor in New Orleans who studies infectious diseases. She told Reuters wild birds infected the patient's domestic birds, which then infected the patient.
This is not a strain of influenza that can spread between people. It is still a good time to get your flu shot. Flu shot's going to prevent not avian influenza, but seasonal influenza and the possibility of being co-infected with those viruses, which is really what we're more concerned in the long run, that this bird flu that we have spreading across the US right now has some kind of mutation or a reassortment event, which makes it more transmissible between people, which is what we have not seen yet.
Experts around the world have been studying bird flu's effect on animals and the risk to humans. Nearly 70 people in the U.S., most of whom are farm workers, have contracted bird flu since April. The virus has circulated among poultry flocks and dairy herds, according to the CDC.